What is the role of creatine kinase in muscular dystrophy? Creatine kinase, often abbreviated as CK, is an important enzyme found mainly in skeletal muscle, heart muscle, and brain tissue. In the context of muscular dystrophy, CK serves as a key biomarker that indicates muscle damage. When muscle fibers are injured, which happens in muscular dystrophy due to the progressive degeneration of muscle tissue, CK leaks out of the muscle cells and enters the bloodstream. This results in elevated levels of CK in the blood, making it a crucial tool for diagnosing and monitoring muscular dystrophy, particularly Duchenne muscular dystrophy, often referred to as DMD. In muscular dystrophy, the absence or dysfunction of dystrophin, a protein that helps stabilize muscle cell membranes, leads to fragile muscle fibers that are more prone to injury. This increased permeability of the muscle membranes allows a significant amount of CK to escape into the bloodstream. Consequently, individuals with muscular dystrophy frequently exhibit markedly elevated CK levels, sometimes many times higher than the normal range. This elevation in CK levels typically occurs early in the disease process, often before noticeable muscle weakness is present, making CK a valuable marker for the initial assessment of muscular dystrophy. Interestingly, CK levels tend to be highest in younger patients with DMD, particularly between the ages of 2 and 5. This reflects active muscle damage during a period of rapid disease progression. As the disease advances and muscle mass decreases, CK levels may decline, which correlates with disease progression rather than age alone. Therefore, serial measurements of CK can provide important insights into the stage and activity of muscular dystrophy. While elevated CK levels are commonly associated with muscular dystrophy, it is important to note that they are not exclusive to this condition. CK levels can also rise due to other muscle injuries or diseases. However, in the right clinical context, elevated CK supports the diagnosis of muscular dystrophy. CK testing is often included in the initial evaluation when symptoms of muscle weakness are present, helping to differentiate muscular dystrophy from other potential causes of muscle symptoms. In summary, the role of creatine kinase in muscular dystrophy is primarily as a biochemical indicator of muscle fiber damage. It helps detect muscle injury early in the disease course, supports the diagnosis of muscular dystrophy, and allows for monitoring of disease progression through changes in serum CK levels. This information is vital during the initial assessment of muscle weakness symptoms and can guide further diagnostic steps, such as genetic testing or muscle biopsy. However, CK levels alone cannot determine the specific type of muscular dystrophy or its severity. They must be interpreted alongside clinical findings and other diagnostic tests. From the perspective of muscular dystrophy, CK testing is a valuable, non-invasive tool that aids clinicians in identifying muscle damage and assessing the disease process. Patients with elevated CK levels should seek professional medical evaluation for accurate diagnosis and appropriate management.